You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. According to my first guest, no more dentures. Get a fixed set of teeth in just a few appointments. With us, we have Washington's dental implant dentist, Dr. Lance Timmerman. Dr. Timmerman, welcome to the program.
Thank you.
Now, for people that don't know you, you do a lot of things. So who's a typical patient that you see, and what are the different procedures that you do?
A typical patient really is everybody. Okay. We do all the small things and the big things, from cleanings and fillings, people with periodontal disease or gum disease. We have a laser that can help treat the tissues, as well as when we're cleaning off the tissues of the teeth. We do Invisalign, but not just Invisalign, which, if you're not familiar with, it's an invisible way of getting straight teeth.
All right.
We also have what's called 6-month braces, which is fairly new to the market as well.
It's like fast braces.
It's kind of like fast braces. The teeth aren't really moving any faster, but the focus is just the front teeth, the anterior teeth.
And they're clear? They're
clear.
Not metal?
There's no metal. The brackets are tooth colored, so they're virtually invisible.
You have a model right there.
I do. In fact, I do.
Okay, so this is not like your regular
No,
orthodontic.
it's not like regular braces. We usually tell people it's an alternative to porcelain veneers and not an alternative to full braces.
Okay.
And the reason for that is the goal is different. We're not making perfect bites. We're not correcting everything that full orthodontics can do. Just like when we do porcelain veneers, we're still leaving an overbite behind, or we're correcting things, but not everything.
You also have a machine that makes, I guess, crowns right there.
We do.
While they're waiting.
We do have the one-stop shop single visit crowns. We also have
You're the fastest crown guy in Washington, I jokingly said.
Yeah, we're pretty efficient. We don't cut any corners, but because I see one person at a time, I'm not running from chair to chair, room to room, and I'm able to focus on each person individually, and we can typically get people in and out in 30 minutes.
Yeah, you were saying that, like half off the normal time of a crown.
Yeah, we've had people that decline treatment because they thought that, it's going to take me 2 hours out of my life to do this, if they just knew that really, because of our efficiency, we could get them in and out, usually before work. They don't even have to take time off.
And the dental implant crowd. So you have denture wearers. Who's the typical person that comes in for the dental implants?
For dental implants, it would be anybody missing a tooth.
Okay.
So whether it be a single tooth missing or all of the teeth.
All right.
Is a candidate.
Okay. Now, you don't look like a dentist, by the way. Do people tell you that every once in a while?
No.
You never hear that you don't look like a dentist. You don't look like, your teeth look like you could be a dentist. They're perfect teeth.
I work out.
But so I always like to ask, so when did you know you want to be a dentist?
Well, all growing up, I always knew I wanted to be in healthcare. I remember my 4th grade teacher, we had a conversation about going into medicine. Both my parents, my mother was a teacher, my father was in banking, and they both said, don't follow my footsteps. So I knew it was going to at least not be teaching or banking. When I was in college, I had a degree, in college I had a job delivering for an orthodontic lab. And so I met a whole bunch of orthodontists and dentists.
And you said, that's what I want to do?
Everybody seemed to like their job, as opposed to my parents, who kind of tolerated their job. And so I thought, well, maybe we'll refocus our efforts and kind of go that direction.
Your brother is a dentist, is that right?
He is.
Who was first?
It was me. I'm the older brother.
Did you talk him into it?
I kind of twisted his arm, and he found his way into dentistry as well.
So tell me a little bit about your training in regard to dental implants.
Well, initially my exposure with dental implants was just to restore the implant. People would go to the surgeon, and he would place the implant, and then they would come to me, and I would put the crown on the implant. And so I was only doing half of the job and sharing.
Is that how it's normally done, by the way? 2 people involved?
Majority of the time.
Okay.
You're going to have multiple offices involved.
All right. That's not how you do it.
That's not how I do it. I got interested in doing the surgery as well. In fact, actually, I didn't even want to do the surgery. I was getting cases back from the surgeon that were very difficult to restore. It was at an angle that was hard to put a crown on.
When you say restore, you're talking about very difficult to put the crown, the tooth on top.
Absolutely.
Okay.
It was difficult, and I thought, well, maybe it's my fault. Maybe I should tell the surgeon, put it here and in this way.
Like the angle or whatever?
Exactly.
Interesting.
So I went to an institute to learn how to just treatment plan better and place a guide to then give to the surgeon. And I found out that that was actually probably the hardest part of all about doing implants is the planning. And the actual surgery itself, while still technical and detailed and involved, less cumbersome and less challenging than the planning itself. And so initially I just started off just doing single teeth and just one tooth at a time, which kind of then led to bigger things. And so now I do it all.
So you're kind of an education fanatic. And we talked on the phone. I mean,
Yeah.
3 times what's required to be a dentist, at least, you said you go to.
Yeah, the average.
Why is that? Is it? I mean, is there that much to learn? Or
Things keep changing. And I don't think that if I'm keeping up with the changes, I think it's my obligation to be able to give the patients what the most modern and current thoughts.
All right.
So, part of it was an inferiority complex. When I graduated, I didn't know where I stood in my class, so I wanted to catch up. So I kept taking classes to catch up to my classmates. I think I leapfrogged a few of them.
Okay, good. Now with dental implants, okay, so why is it what used to take, and we at the top of the show, we said no more dentures.
Correct.
Get a fixed set of teeth, I mean a full arch of teeth in just a few appointments. That's true.
This is true.
Okay, and why is it what used to take you, let's say 8 months, 9 months, or 6 months, now can happen in the same day or in a visit or two? What's changed? Why is it so fast now?
Well, we probably have to back up a little bit the way that implants were developed. Originally, it was like most good things are discovered on accident. They found that titanium could fuse to bone. So when the implants first came out, they were first putting them out, it was a smooth cylinder. And so as they place it into the bone, if there's no stability, it wants to move around, they had to wait for everything to heal. So there was a surgery involved just to place it, and another surgery involved to eventually uncover that implant that we waited for it to fuse.
Okay.
Nowadays, with the way that the implants are designed, we actually have some stability at the day that we place the implant. So with this initial stability, we can kind of cut down some of the visits, and we're already to stage 2 before we've even left the surgical field.
So is it true that you could do things like teeth in a day?
Teeth in a day is possible.
For certain people, and they go in without a tooth, they leave with a tooth on top of the implant.
Right.
How soon can they eat?
They can eat right away. It's a little bit confusing though, the teeth in a day. It's not the final restoration that's there that day. It's a provisional or a temporary.
But it's a tooth.
But it is like a tooth. Tooth, a denture tooth, whatever it is that's going to be the final restoration is there that very day. It's just it's going to be replaced later on.
So what are the categories then of dental implant patients that you see?
The categories would be single tooth, person missing their front tooth. That would be one category. Missing a few teeth, where we're going to support a bridge with a couple implants, would be the next step. People that are missing all of their teeth. That would be people that are in a denture that need to replace that, or the people that are going to lose all their teeth.
They've been told their teeth have to go.
They've got gum disease. They've been told they're hopeless. There isn't anything that can be done to save them, and they're looking for an alternative.
What's the clear advantage with, if you're just missing one tooth? Why a dental implant over, I guess, traditional dentistry?
Well, with a single implant, you can focus on just the single tooth. You have a single tooth problem, and you can give it a single tooth solution. Okay. Whereas traditionally, what we'd end up doing is...
Do you show this to patients, by the way?
I do. And so these are larger than life.
All right,
so,
okay.
But traditionally, when you're missing a tooth, we'd end up having to sacrifice tooth structure of the adjacent teeth.
What does that mean, sacrifice? You're carving them
We're
down
taking it
a little
away. It's gone.
Okay.
And it's never going to come back. But we replace it then with a bridge. And the bridge is all 3 teeth are all in one piece. And we can do that. And there's really nothing wrong with that. We do it all the time.
You do that every day?
We've been doing it for years. And this should last about, we tell people, 10 to 15 years. The challenge, though, is homework. You're trying to keep it clean. You have to floss underneath. If you get a cavity on the tooth that's supporting this, then the entire thing needs to be replaced. Sometimes when you get the cavity, when we finally get to replace it, we end up having another tooth involved. And so it becomes a 3-tooth problem. Now it's a 4-tooth. It becomes kind of a domino effect.
Okay.
Whereas with the dental implant, we can actually just leave the adjacent teeth. If they're healthy, then I want to leave them alone. And we can actually just replace that missing tooth with just a single implant. And that goes in place.
Do you think it prevents future tooth loss?
Absolutely. Our bone stays in place under what we call tension. So if tension to the bone, we have tension to the bone from our teeth. The ligament that holds the tooth in place keeps bone. If we end up losing the tooth, over time that bone is going to shrink away.
Okay.
40 to 60% of the bone volume is gone in the first year of tooth loss. By placing an implant there, we recreate the tension that the tooth had, and we're able to preserve bone.
And they last. I mean, they can last forever. I mean, as long as you live. I mean, it's like a regular tooth.
Some patients, we will look at them and say, these implants are going to last longer than they are.
Is that right? So they're even stronger, probably.
Absolutely.
Than a regular tooth.
Much stronger.
So the next level, you say people missing 3 and 4 teeth.
Right. In that regard, similar to that bridge that we just looked at, we could actually place 2 implants in the exact same place that those teeth had been for the bridge. Instead of doing a 3-tooth bridge that has teeth involved. It's a 3-tooth bridge that is implant supported.
So it's more of a permanent
Absolutely.
thing. Because, dentistry and, anticipating your coming, dentists coming in here. Because dentistry is like patchwork, but the dental implants are kind of like, getting your teeth back.
Pretty much.
Now, what about the people that have been told, okay, their teeth have to go? Dentures or dental implants?
Well, actually, those are the people that I want to meet because they may not need to have dentures.
But what about their gums? What if their gums are just, bad gums?
Well, once we
Lose
take
teeth because of that.
Yeah,
Could they get dental implants?
Absolutely, because once the teeth are gone, the gum disease goes away. And so that makes it such that if we place the implants there, we don't have to worry about the longevity of the implants because of the gum disease, because now the gum disease is gone. And so...
And you say sometimes people think they need to have all their teeth removed.
Right.
You save them.
Well, the internet is great. We have people self-diagnosing all the time.
Do they come in? They know exactly what they need?
They tell me what they want. They said, I want this, and they'll tell me brands of materials.
Really?
Yeah, it can be, and I give them what they want, well, unless they're asking for something that's just impossible. Okay. But they come in really well educated. Sometimes I need to educate them a little bit more, because some people say, I need all my teeth out, and when we actually do an examination, we find that, well...
Have you had that happen?
Absolutely. We just, in fact, last week had a guy giving me emails. So I correspond via the internet as well. And he emailed saying, all my teeth got to go. By the time we met, some of them, he was right. Some needed to go, but there were others that were absolutely savable. And we really could limit his expense and the surgery because we're really just focusing on the posterior teeth and able to save the front teeth.
So the denture wearers, they benefit the most with dental implants?
Absolutely. Most of the denture wearers, their biggest complaint is the dentures move. They're in their mouth, but they don't stay put. It's the stability is the main issue. Implants can be a fairly simple procedure and simple solution, and make the dentures a lot more stable.
Okay, now you brought some models.
I did.
What are the options for denture wearers?
There are lots of options for denture wearers.
So denture wearer watching this, they come in. What happens on that consult?
We need to determine what the best solution is for them. A lot of that is dependent on how much bone, how long they've been wearing a denture. Denture wearers, if they've been wearing a denture for 40 years, is certainly a different thing to treat than someone who's only been wearing a denture for 3 years.
But even if somebody's been wearing a denture for 40 years,
absolutely,
they can still get dental implants?
Absolutely.
Like a full arch of teeth that we're talking about?
Yep.
Interesting. But don't you lose bone? Isn't that part of the problem with wearing a denture over 10 years or so?
Yeah. Yeah, so the sooner I can get to people, the more bone we've got. In fact, here's an example of how bone progresses. When we first have all of our teeth.
So those are all lower jaws?
This is all the lower jaw. When I have teeth, we've got plenty of bone. As time goes on, we take the teeth out, there's a little bit less. But after 40 years, you have a lot less. People in this situation still can have implants. It's not
a full arch of teeth? Or
full arch of teeth.
Interesting. Now, we talked in the green room. You say that, and maybe, I'm putting the words in your mouth here, I don't know if it's frustrating, but is it frustrating for you? You say that people will say, yeah, but my other dentist said that I didn't have enough bone for the procedure.
Yeah.
How often does that happen?
It's
here and there?
It becomes frustrating. It probably maybe less now than before. People would come to me for an examination, a consultation. They'll go somewhere else for a second opinion, and if they go to an office that isn't as aware or as current in technology, they might say that it's impossible. And if they go to another office for a third opinion, and if their exposure and education level is the same as the second one, then 2 out of 3 said that what I suggest is impossible.
So you're saying they might have gone to 2 other dentists that said, you don't have enough bone, or you're too old, or whatever. Do you think there are patients, though, knowing you're going to come in? Okay, and I think I've told you this story that my mother at 73 years old, I learned about this and heard about this. I said, you should consider dental implants, and she said, my medical doctor told me I was too old for dental implants; they would fall out.
Right.
Does that come up? Do you think that there's people out there that think that?
It happens all the time. In fact, probably a more common situation is some of the pharmaceuticals that are being used can affect the success of the dental implant. And usually what they're told is that you can't. And it's not that you can't, it just means we have to manage you a little bit differently.
What's the oldest patient you've ever had that's had this done?
Oldest one I've ever done was 84.
84?
So fairly old.
For just one implant or like a...
It was a denture stabilizer. So the denture, it changed the way that she was able to eat much more efficiently.
Does it hurt? It sounds very painful, by the way.
No.
Like on that woman, did she complain about pain?
Not at all. In fact, there's no nerves in bone. It's the gums and lips that have all the nerves. So as far as the surgery and post-operatively, that really was, I think we used Tylenol.
So, when I look up on the internet how many people are denture wearers, there's 40 million, people have upper lower dentures. So in Washington, would you say tens of thousands
Sure.
have an upper lower denture?
Yeah, about that.
Well, if it's so good, if dental implants are so good for these denture wearers, why aren't they all doing it? What's your take?
Well, these people just don't know. They quit going to the dentist once they lost their teeth.
Good point.
And they'd probably been 20, 30 years since the last time. And 20, 30 years ago, implants really weren't a very good option. They weren't as successful as they are now. So since they're not really being told of their different options, they're just not aware.
So you think that, when a denture wearer comes to you and it's a consult, what do they ask every single time on that consult? What do they want to know? What do they tell you?
Will I be able to eat steak again?
Really? They
Yeah.
said, okay.
They want steak or some other food that they haven't eaten in years.
What do you
because they
say?
Can't. Absolutely.
How soon?
The day of surgery.
Is that right?
Yeah. In fact, I give them a little gift card to go to the steakhouse.
Oh, is that right?
So that they go have a steak on me.
Okay.
Kind of to
What
prove them
about,
right.
look, if you're 70, 80, and that's very young today, everybody is always talking about fiber, like broccoli, al dente.
Sure.
Can they do things like that?
Absolutely. So the denture wearers, most of the time, they're really just kind of mashing their teeth together. They don't, the dentures together.
So the food, they just can't.
They're not very efficient to chew. So it's going to limit the types of foods that they can eat. There's no teeth in their stomach. So
Good point, yeah.
they're depending on these loose-fitting dentures that don't interdigitate very well.
Is there such thing as a happy denture wearer? I know a few people with dentures. I've never heard them complain.
I don't know, happy, no. A tolerant denture wearer, sure. But I don't think any of them are happy. Well, I take that back. Some people are happy because the teeth, they remember having teeth, and teeth were such a problem that the dentures are an upgrade from what they were.
Okay.
So I back up. Yeah, I think there are some happy denture wearers.
So what are the different levels? Like what's the basic to getting a fixed set of teeth for denture?
Well, the basic level for the denture wearer is just having two, and that would be something like this.
Okay, so that's a lower jaw.
Lower jaw, denture now snaps in. We can snap it in place. You'll snap there.
I'm going to take a look at this. Okay, so when I do this, so these two holes right here, I want to try to show this on camera. There's snaps, snap here. Is this accurate?
Absolutely.
Because this is hard. Well, my hands might be a little bit greasy. Do they ever have a tough time pulling them out?
Yeah, in fact.
So 2 implants.
Yeah, 2 implants is kind of the first step. In fact, we do, you were saying that's kind of tough. We do have different liners for people to make it more retentive or less retentive for the people that have a hard time getting up. They're that retentive.
Really? So if they get the 2 implants down here, snap in, snap out, no more adhesive, what about the back? Doesn't the back tilt a little bit?
No, the implants are going to help keep it in place. There's still going to be some tissue support though. So it is going to still be touching the backbone, the back tissue. Okay.
So the 2, pain is not something...
Pain's not an issue. We're able to...
What do they take the next day? I mean, do they take just like Motrin or...
Usually
what do you give
Tylenol, Motrin. I've had a few where they really didn't need anything.
them? Is that right?
Yeah.
But that's their biggest fear, right?
Most of the time, pain is...
They want to know, you say on the consult, can I eat a steak?
Eat a steak.
Does pain...
hurt.
Question number 2?
Right.
What do you tell them? Like, what's your
tell
speech? I mean, you must have this plan, right?
Well, a lot of them don't like to walk away without something for pain management. So I'll give that to them, but I'll tell them you might not even need it because it's that comfortable of a procedure.
Okay, so 2 implants, but you're not like a huge fan of the 2. You'd
It's
rather
okay.
put...
It's level 1, so to speak.
Okay.
It's the intro level of wearing dentures, the implants with dentures. One step up is to have 4. It's a little bit more stable. It's kind of like legs on a table. If we have 4 legs, it's certainly going to be a lot more stable.
Okay.
But it's still, if it's snapping in and snapping out, it's going to be, it's still a denture. And a lot of the people coming to me that have dentures don't want dentures anymore. They want something else that stays in place. So the next level up would be 4 implants. Now what we can do with 4 implants is actually have a bar that is milled in place. So this is going to be a lot more stable than just having the 2 implants to snap in, snap out. This is actually going to snap in and snap out, but with this bar.
And this is 4. Okay.
4 implants with a bar.
And this is accurate. This is about how it'll feel. Okay.
Yeah. But then the chewing
Nice.
forces, because of that bar, is going to allow even greater stability and greater function. Also, on an upper arch, we can get rid of the roof of the mouth. It doesn't cover the roof of the mouth anymore.
Okay.
That's commonly a problem or a concern people have of how it feels.
So this procedure, all on 4 though. Get a fixed set of teeth, a permanent set of teeth with just 4 implants. You do that?
We do that. In fact,
Okay.
I've lots of training with it. We do it all the time. It's a great service. You have a full arch of teeth that are screwed in place. The implants are placed. There's just 4 of them. There's certain angles. It's a great alternative for people that were told originally that they couldn't have fixed teeth. There were always going to be dentures, always going to be something removable. However, that doesn't come without drawbacks. It's not perfect. It's not for everybody.
All right.
There's a saying out there, all on 4, none on 3. I'd much rather put one more implant in there, all on 5. And if we have one of them fail, we still have 4 as for stability.
So 5 implants, and you get what? Full arch of teeth?
Full arch of teeth.
Do you think people count their teeth and think, oh boy, this is going to be way too expensive?
Sometimes. I've had people say that I need, 32 implants? I've had 32 teeth. That means 32 implants. We don't typically do that.
But this all on 4 or all on 5, as you say, with 5 implants giving a full arch of teeth. I mean, isn't that what everybody wants? I mean, over a snap in, snap out?
Yeah. Nobody really wants a denture. Nobody wants to take their teeth out. Now that people are joining the dating world again, don't want their significant other to see them without teeth.
Okay.
People want teeth that stay put.
Could you make them look real? Cosmetic?
Absolutely.
I always feel like I could spot dentures.
You can't spot mine.
Because you're a cosmetic. I mean, how much cosmetic goes into this?
There's a lot of overlap in my cosmetic dentistry training with the implant training, because like you said, the last thing we want is for people to know that it's a denture. We want it to look natural. We want it to look and feel real.
And pain is not an issue.
Pain is not an issue.
So, imaging now. What type of imaging are you doing for this?
To do this correctly is called a CT scan, cone beam technology. That's where we can take an image of the entire skull, and we can actually take different slices at different angles to see how much bone there is, what the volume of the bone is, the angle that the bone is. So we're not blindly going on faith that we can put an implant in bone and it's completely covered in bone. Well, and another benefit to the imaging today is precision. It used to be somewhat of a blind procedure, even with taking away the tissue and placing it into the bone. We weren't sure if we had the right angle, if there was adequate bone where it was. And with the CT scans today, we're able to actually plan it out in advance, and we can place the implant knowing full well with 100% certainty that the implant is going to...
Now, what about the upper? Because the upper in a denture already has enough suction. Is that correct?
Right. There's less complaining about the uppers because of the suction, but ask any denture wearer when they first got their denture, that was one of the first things they hated, was it covered the roof of their mouth.
Interesting.
So if I can place 6 implants in the upper arch, I can place a full set of teeth and nothing on the roof of their mouth. They can go back to tasting foods the way that they used to taste them. It feels more comfortable because it's not as big and as bulky as it used to.
So no more dentures. You also told me you're changing people's lives.
Changing lives.
Sounds like an exaggeration. What do you mean by that?
I'm changing lives in many ways. From the dietary aspect, they're able to chew food. They're able to go back to foods that they loved and they missed. They're looking differently. I mean, I think a lot of people's health is the way they feel about themselves, and having the confidence that their teeth aren't going to fall out in a social situation, or it looks better. They come in with a denture that looks like a denture, and they walk out with a set of teeth that looks like a brand new smile.
That's good. That's good. Now, so young or old, I mean, is pretty much everybody a candidate for dental implants?
Everybody's a candidate. Everybody that's missing a tooth.
And they would all do it. I mean, if there's 10,000 plus, do you think if they knew the benefits, they would all be coming in?
If they knew,
there's not enough dentists to handle the need, frankly.
Correct.
Right?
Correct. Yeah, they'd all be. If everybody knew what their options were and how affordable it can be, they'd be lined up at the door.
So we're out of time. Great information, but a recap for the denture wearers. Their options.
Well, 2 implants for denture, snaps in, snaps out. We can place 4 implants to snap in, snap out a denture. Give me 5 implants and I can fix it, and it doesn't come in, it gets screwed in place.
Okay. So the fixed set of teeth is the highest level then?
Yeah.
Where you actually create teeth again.
Right. Probably the top level of implants would be something like this, where we actually have a milled framework that then you have individual porcelain restorations cemented onto that. And it used to be made out of just metal, but now we've got milled zirconium. And so we have the entire arch, entire framework there, but now we're going to have porcelain over there. This is
like little veneers over each one?
Right. This is the closest thing we've got to the cosmetic dentistry we've got. Whereas the all-in-4 might be more acrylic, look a little bit more denture-like.
Like a plastic in your mouth.
Right.
And this is like
teeth. This is porcelain. This is going to feel like the porcelain bridge that you had in the past. This is the...
So, I mean, that's really the best you can I mean, it's like getting your teeth back.
Absolutely.
Okay. Of all the areas of dentistry, and because I know you do cosmetic, you do extractions, everything. Is it the happiest group of patients where you could take a denture wearer that had a loose-fitting denture and then give them something like this?
These are the groups of people that give me hugs when they're all done. You know, when I'm doing a filling or extracting a tooth, they don't give me gifts. These are the types of people that come back and love me.
So in a perfect world, somebody watching this, denture wear, upper and lower, if they came in today, how soon before they could have an upper and lower arch of teeth?
Randy, just a matter of a couple weeks, they're right back to a new set of teeth.
Really? Really? Okay, well, good. I want to thank you for coming on the show.
Thank you.
Now, if they visit your website, they could find out more there. And at your office, you'll meet with them one-on-one?
One-on-one consultation.
Is it a free consultation?
Free consult.
Now, what about insurance? Does it cover any of this?
Unfortunately, it doesn't really contribute very much at all.
Okay.
We do our best to maximize your insurance. We will help with that. But for the most part, we do find ways to make it affordable.
You have patient financing?
We have patient financing programs that we work with. Unfortunately, Medicare doesn't contribute. So
Okay.
it's mostly an out-of-pocket expense.
Okay, no more dentures. You're going to wipe out all the denture wearers in Washington?
That's the plan.
Is that your goal?
That's my goal.
All right. Well, thank you for coming on
All
the
right.
show.
Thank you.
Great info. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, you can visit our website at wellnesshour.com. Show this to a friend. Just put in Dr. Timmerman. You can put Washington Dental Implants. You'll find them there too. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.